Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Food and Drug Administration, or FDA, sets the record straight. China's Sinovac vaccines are safe and effective for people less exposed to the virus. And after giving the emergency use approval to Sinovac's COVID-19 vaccines, authorities now say it's now up to China to fulfill its delivery and promised quantities. But with seemingly low confidence on Chinese vaccines, how will Sinovac convince the public to take the shots? Sinovac Biotech General Manager Helen and Food and Drug Administration Director General Eric Domingo join us live. Officials are determining who will first get the COVID-19 vaccines from Chinese firm Sinovac. That's after the Food and Drug Administration approved the brand for emergency use. Yet the agency qualified that the vaccine is best for healthy individuals, those within a certain age bracket and not exposed to the virus. No date yet as to when the vaccines will arrive. Let's go straight to the source of the story. We have Sinovac Biotech General Manager Helen Yang. Miss Yang, it's good to see you again and welcome to the source.
Yeah, thank you for having me.
So I want to start with this because obviously the FDA has already granted Sinovac its emergency use authorization. I want to first discuss about the Sinovac vaccines that are set to arrive in the Philippines. There are two possible categories here. First would be the donation from China. The Chinese embassy earlier said that we can expect about 600,000 donated Sinovac vaccines. First of all, has the Chinese embassy reached out to you for the promised 600,000 vaccines?
Yes, we are in close communication with the embassy regarding to the supplying of the 600,000 doses. And currently the product is being prepared, is ready. If we finish all the procedures, I think we will be soon be ready to supply the product to Philippines.
So the 600,000 vaccines right now is available?
Correct.
And when can we possibly expect the delivery? Because there are news reports that since the EUA was granted to Sinovac, it could take 3 to 4 days. Is the delivery of the 600,000 donated vaccines possible within this week?
I think it's still possible. Actually, we move very quickly, trying to be ready to supply the products. I think if we can do it sooner, it won't be later.
Okay, so possibly still this week. Are you waiting for any other requirements coming from the Philippine side regarding these 600,000 donated vaccines?
No, I think after we have the EUA issuance, we cleared everything from the approval side. And now is we need to complete the schedule of the delivery and custom procedures that will normally take a few days.
A few days. So then would you say there's a high probability that it will arrive by the weekend?
It could be, but it's difficult to pencil it down for now. We will do our best.
Mm-hmm. Okay. Now, the second component here, Ms. Yang, is, of course, the purchase of the Philippines of the Sinovac vaccines. I remember the last time we spoke, what really the Philippines had at that time was what was called a term sheet. Can you tell us now the latest on government's plan in procuring Sinovac? Are you still on the level of the term sheet agreement, or has there been any progress?
Yeah, there are progresses. Normally the agreement review and revisions by each side take time. And this is a very serious deal with the government and supplying a products which is used for people. So it will take some time, but I think the sole purpose is to have Philippines to have the products, to have an early access of the products. Therefore, that I think these 0.6 million doses shipment already made that goal. And of course, we will work very closely with the Philippine government and to finalizing the future supply of the product in order to have a sustainable supply for Philippine people to use the products.
But just to be clear about this, are you still on the level of the term sheet agreement, or has a supply agreement been signed?
No, the supply agreement hasn't been signed yet, but actually when we are working on the term sheet, it is in parallel, we are preparing and exchange ideas on the supply agreement. But because we thought the agreement may take a longer time, so we start with the term sheet. But now we have these first parcel of the donated products to be supplied. I think we have already been able to start the delivering of the products.
Yeah, that's why we need to make it clear, because the 600,000 was committed by China as donation to the Philippines. But what's really more important is the millions of Sinovac vaccines that government wants to procure. I remember we're looking at about 25 million, supposedly, by the end of 2021. So where are we now in terms of this agreement, or when do you think the supply agreement will be signed?
We are in a discussion with the government on the revision of the agreements. And of course, it will take some time, but I think Sinovac will try our best to secure the 25 million doses for Philippines within the year.
You'll try your best, but that's not a committed number, just to be very clear about that.
Oh, I mean, for 25 million doses, Philippines will have our commitment to supply, and when to supply, and how many shipments we're going to make. And for that, we need to discuss and finalize with Philippine government. But more importantly, is to allow Philippine people to have the access to the vaccine. And this first shipment will make that happen.
Right, but there is a bigger number, obviously, that we're talking about 25 million by the end of 2021. So this procurement or supply agreement needs to be assigned possibly as soon as possible in order to make the next delivery. I know you're saying it takes time, but when you say it takes time for this procurement from Sinovac vaccines, how much longer? Are we looking at weeks or even months?
I think we're trying to get a monthly supply, if that satisfies the Philippine side. I think for Sinovac, we're trying to build a schedule which is satisfying the need for the country. Because I think depending on the how fast the vaccine would be used, and actually 25 million doses is not a very big number for Sinovac. Currently, we have built up a 1 billion doses capacity, and we are expanding to 2 billion doses capacity annually. So I think we'll work very closely with the Philippine government in order to ensure the supply of the products in time.
That's a lot of supply, but also we need to underscore the fact that you are supplying vaccines to many other countries, such as, well, Indonesia, Turkey, Brazil, and very recently, I believe, also Thailand.
Yeah, for Thailand, it will be arrived today. Yeah.
Yes. Okay. So once the supply agreement is signed, once we get note of the fact that the supply agreement is signed, how long till the arrival of the batch of vaccines from this agreement between the Philippines and Sinovac?
Oh, actually, the delivering of the purchase quantities is not solely depending on the signing of the agreement. I think we're trying to be flexible because this is a pandemic. And if the government allows, that's why we start with the term sheet. If the term sheet works for both sides, I think for Sinovac, it's okay if it's a binding term sheet. And if that works for Philippines as well, we can in parallel to finalizing the agreement, but we can start the delivery. So I think it just in the past few
I
weeks,
see.
people are both sides, China side and Philippine side, are working very hard to get these delivery done and also to apply for the EUA. So I think after we got these products applied safely, we will quickly start to discussing and planning for the future supplies.
What would you say, Ms. Yang, would be the challenges right now in the purchase agreement between the Philippines and Sinovac?
I don't see any challenges. I know that right now people's having an urgency of accessing the products. So that's why I said we're trying to be flexible. If term sheet works, we can start the delivery. Actually, the prior plan is that in March, we are in discussion of supplying additional 1 million doses to Philippines. But right now it's still the end of Feb. We still have time to finalizing that plan.
So that's still a possibility, Ms. Yang, because that's where I wanted to go. Last we spoke, it was in the news through Secretary Galvez regarding Sinovac that we were expecting from this purchase agreement. I'm going to set aside the donated vaccines already. We were hoping for about 950,000 in February, about 1 to 2 million in March, and so on and so forth. So it's best to assume right now that that 950,000 will not be arriving by February. So in March, what number could we possibly expect from Sinovac?
I think tentatively, I thought we are talking about like a 50,000 doses in Feb and then 950,000 in March. But given the supply arranged in Feb, so I think the current tentative plan would be around 1 million doses in March.
Okay, and I also saw in the news yesterday, Ms. Yang, that there is a group of Filipino-Chinese businessmen who now want to order vaccines also from Sinovac. Are you in talks with them?
No, not directly, but we do have a local partner who are acting like our distributor because the local license holder needs to be a local company. So our local partner is in the discussion with them.
Yes. Okay, and also I wanted to find out from you: are you requiring an indemnity agreement from with the Philippines?
I think the general identification it is for is similar to all the countries because the vaccine is still in research, and we believe that every country will evaluating the data up to now, and the research it needs to be going on for a future study because normally vaccine study takes years. And now it is under an emergency and during a pandemic. So I think there needs to be some identification for using the vaccine.
Okay, so clearly you're saying that the Philippines must have an indemnity agreement with Sinovac.
Right, right.
And has that progressed between Sinovac and Philippine authorities?
That was part of our agreement. And actually for the term sheet, we'll have a similar language there as well. But no matter what, actually for the manufacturer, we are providing a product with a good safety. And we need to study the longer term consistency of the antibody level. That needs to take time. So therefore, that's why many countries, I think currently over 10 countries, already start receiving the vaccine and start to use based on the good safety profile.
And very quickly, I wanted to get your reaction on the EUA on Sinovac. The FDA says, we can use this, but not recommended. Really, the words were not recommended for frontliners and seniors. I wanted to get your quick reaction on this, that they're not really recommending it for seniors nor frontliners.
Right. Yeah, I saw the approval. I think, of course, as a manufacturer, we're trying to provide the data we collected. But I want to make it clear that actually Sinovac vaccine is the only one currently on the world is to study in Brazil only on healthcare workers. And those people are living in a very challenging environment. And if we see the numbers that over 12,000 volunteers, there has been over 250 cases collected. And if you calculate the efficacy rate comparing to the efficacy rate in Brazil in that region, that's 4 to 5 times higher. So that means the people are working in that environment is very risky. But actually for our numbers, we understand that people when see 50, they feel why it's not 80, why it's not 90. But actually the 50 is to include all those cases with a very mild symptoms, even without any requirements for any medical assistance. So actually the vaccine protects people 100% for hospitalized and fatal cases, and over 80% to protect the people who need the medical assistance. I think this is a very good vaccine to protect and to lower down the burden on the healthcare system. And of course, frontliners are the people working in the hospital is a high priority to be protected. And in many countries who start using the vaccines, they start from this group of people.
Are you at all disappointed with the Food and Drug Administration saying it's not recommended for seniors or frontline workers who are directly treating COVID-19 patients?
No, I do not feel any disappointment or happy on any decision because, as a manufacturer, we study the product, we supply the dossier to government to review, and we respect any government to decide on how they want to use the vaccine based on the data they collected.
Okay. Yeah. I ask that, Ms. Yang, because in Indonesia, we know that Indonesia's President Joko Widodo has been vaccinated, but he is, I believe, 59 years old. However, I did read that the Indonesian Vice President, Maruf Amin, was vaccinated about 6 days ago, and his age is 77. And let me also add that Turkish President Erdogan was also vaccinated, and he is 66 years old. Is there anything, any data possibly that you gave Indonesia and Turkey that made them confident that it could be used for seniors, and maybe a lack of data in the Philippines? That's why the FDA said it's not recommended yet for seniors.
No, not really. Actually, we provide the same group of data to all countries. They're the same, and we do have elderly data for our phase 1 and phase 2 elderly study, 60 years old and above, and those data has already been published on the Lancet, and also in our Brazilian trial. And those are including the people from 18 years old and above. And all this data are showing that vaccines are safe, no matter from a healthy population, 18 to 59 years old, or even for elderlies. And also the immunogenicity of this vaccine appearing on the elderlies are similar to the level of people aged from 18 to 59 years old. And we think these are the data that those countries who allowed to use on elderlies are relying on.
Mm-hmm. All right. Sinovac General Manager Helen Yang, thank you again for speaking to us.
Yep, thank you.
And coming up, Food and Drug Administration Chief Eric Domingo joins us live to respond to concerns about Sinovac vaccines. This is The Source on CNN Philippines. Please stay tuned.